I have compiled 7 questions. Hello, Assalamu alaikum. This is Dr. Faraz Ahmad. So you must be knowing that I have made few videos on the SMLE exam and the jobs in the Kingdom Saudi Arabia. So I have got a lot of questions. So I have compiled 7 questions. So in this video, I am going to answer those 7 questions. Those questions includes how many time I can take the SMLE exam, how the SMLE exam is conducted, and how the results are announced, and how the passing score is established for the SMLE exam. Apart from that, I will answer the other question as well, like why SMLE exam is necessary, and after clearing the SMLE exam, what position I can get in the Kingdom Saudi Arabia. At the last but not the least, is Saudi Arabia is a safe country for the single ladies, single females to stay in and do the job as a medical doctor over there. So the first question is this: how many time I can take the SMLE exam? So answer is this: like if you are eligible for the SMLE exam, you can appear in the SMLE exam for the 4th time. Like you are eligible for the SMLE exam and you appeared for the first time in the exam and you were not able to pass the exam, so now you can attempt the exam 3 more times. Like if you failed the exam, then you can avail 3 attempts, and keep in mind you have to avail these 3 attempts in a year, and the year start from the date of your first appearance. Like you appeared in the exam on the 20th January and you got failed in the first attempt, so from the 20th January onward you can appear in 3 further attempts in a year. But if you got pass in the first attempts, congratulations, but your score was low that you were not able to get some job and the residency, so now you can go for the improvement in your score. And please keep in mind that if you pass the SMLE exam, you can go in the 2 attempts to improve your score. But unfortunately, if your score was not improved in the 2 attempts, so what you can do, you can further take the 2 attempts to improve the score. But keep in mind that these 2 attempts will be a year apart. Like you pass the exam and you want to improve, you can improve in 2 attempts. But if you were not able to improve in the 2 attempts, you can further take the 2 attempts. But keep in mind these 2 attempts will be 1 year apart. So the second question is this: how the exam is conducted? Everyone knows that this is a computer based exam. Before going to the exam, you will be given login ID and a password and you will go there. So this exam will be conducted in 3 sessions, and each session will last for 2 hours, and in these 2 hours you have to attempt 100 MCQs. So after attempting the 100 MCQs in 2 hours, you will go for a break of 45 minutes. So 3 sessions, in each session 100 MCQs in 2 hours, and there will be a break of 45 minutes in each session. So the third question is this: how the results are announced? So please keep in mind there is no fixed time for the announcement of results. So normally result is announced between 2 to 6 weeks. Okay, so the between 2 to 6 week of your exam result will be announced, and your result will be in the form of the 2 reports. So out of these 2 reports, one report will be the statement of your result, and in the second report they will give a feedback in the form of the comparison between you and the other candidates. So this is the form of your results you will get in the 2 reports. Fourth question is this: that how the passing score is established. Like you have appeared in the exam, your exam is ended now. Now the question paper will go to the panel of general practitioner. So panel of general practitioner will assess the difficulty level of your questions, and viewing at the difficulty level of the question, they will design a passing score criteria. This passing score will go to the CAC panel for the approval, and after the approval of the CAC, your passing score will be designed. So please keep in mind, these days passing score for SMLE exam is 560. Like if you are going to score minimum 560 mark, you are passing the SMLE exam. But keep in mind, you have to score very high to get the residency and to get the job easily in the Kingdom Saudi Arabia. So the 5th and 6th questions are correlated to each other. The question is why SMLE exam is necessary and what are the opportunities after clearing the SMLE exam. Definitely, if you want to work in the Kingdom Saudi Arabia, like if you are a fresh graduate, you have just completed your MBBS and the internship, and you want to work in the Kingdom Saudi Arabia as a general practitioner, or you want residency in the Kingdom Saudi Arabia, definitely this exam is necessary for you. So after clearing this exam, you can go for the GP job or the residency in the Kingdom Saudi Arabia. But if you are a consultant, you can directly apply for the consultancy and you can apply for the specialist job in Saudi Arabia. And at last but not the least, is the Kingdom Saudi Arabia is a safe country for the single female ladies to work as a doctor over there? So the answer to this question is big yes. So any country where the situation of the law and order is very good, you can go over there, you can stay there. Either you are a single male, single female, anyone if you are, you can go there, you can stay there, and you can work as a doctor. Please feel safe once you are there in the Kingdom Saudi Arabia. So this is the answer of all the questions. If you have any further questions, you can follow me on the Instagram, you can message me, or you can ask me in the comment box. Thank you very much.